Live event going on today. My name's Dr. Jacob Bauer. I'm the founder of Prime Sports Med, located here in Nampa, Idaho. We also have a clinic in Caldwell, Idaho. What makes us special and unique is that we're an integrative clinic. We offer multiple services here. We offer physical therapy. We offer chiropractic. And not just chiropractic, our chiropractors are what we call sports chiropractors. So we do a lot of soft tissue work, rehab, advanced sports treatment techniques. And we also have really good massage therapy. So multiple massage therapists, they're all highly trained and very good. Deep tissue or corrective exercise stuff. Lots of our therapists are very good at what they do in the soft tissue realm. So anyway, we're going to have this first broadcast to kind of just explain how it all works. It's kind of evolved over the years. We have a really good team, the best team that we've ever had. We have Dr. Simonson, who's a doctor of physical therapy. He was the College of Idaho team physical therapist. So he's worked on thousands of college athletes. And we treat a lot of athletes here at Prime Sports Med. So he's been a perfect fit for us. But he's very good at rehab. Highly specialized in low back and neck techniques, so he's a perfect fit here at our office, treating athletes and also treating the complex necks and low back issues that we have. And then we have Dr. Tanner Field, who's also a sports chiropractor, and the three of us doctors are kind of the doctors that we have that work on our treatments the most. And the cool thing about us is we came together as a team. We broke down every single condition possible, and we had guidelines. We looked at the evidence-based guidelines of how you treat certain conditions. So if someone has plantar fasciitis, we automatically direct it to a certain type of provider. If you have shoulder impingement, if you have a knee meniscus tear or ACL tear, we have everything organized and broken down to which condition sees what provider and when. And we work together as a team. Jared, our physical therapist, really believes in what we do here with chiropractic and our sports techniques and our massage therapy, our soft tissue work, and we believe in what Jared does with physical therapy. So we're always bouncing patients back and forth. It's quite amazing because there's certain conditions and certain patients that do really well with physical therapy, and then there's some that don't, and they do better with the manual therapy and chiropractic stuff that we do as chiropractors and the massage therapist, and vice versa. Sometimes we'll send people to him and they don't get the results, and then he kicks them back to us and we get results. Usually it's the opposite way. We usually, a lot of times we don't have results. We'll get people over to him and he fixes them as well. So we're in it as a team. We co-manage lots of different conditions and treatments. We get lots of doctors' referrals from local medical doctors. And we have lots of athletes that come in from the high schools, the Nampas, the Skyviews, the Valley Views, all the Caldwell schools and outliers, even Homedale, Marcine, Melba, things like that. So we love treating athletes, and even if you're not an athlete, we treat everyone like an athlete. And what I mean is we give you extra time and care. So you're not just going to come in and get cracked or adjusted. Obviously, if people want that, they can have it, and a lot of people just want the adjustment only. They love the way that it feels, and they don't want to be in and out. Maybe they're trying to get the work, and so we have those services as well. If someone just wants adjustments, we got that. But we have sports therapy services if someone wants to get adjusted and then receive class 4 laser therapy, graston technique, a little bit of soft tissue, or combine the chiropractic with massage therapy, which is one of the most popular things that we offer, and also adding it with physical therapy. So
Chad Ivy says, Dr. Bauer, the best to do it. And then we have another person who says, how does graston or scraping help with sports injuries?
Yes, so graston technique is these highly specialized stainless steel tools, and we use it with lotion, a lot of times with a stronger type of lotion. We use rock sauce or China gel. It has some methyl and other things in it. And so, for example, say if someone had really bad IT band syndrome, A lot of times they come into the office, their knee's really hurting. They don't know that their IT band is all locked up and has these adhesions. And so based on our examination, we would find that, okay, if we put lotion on the IT band, scrape it out, maybe do a little bit of active release on it, break apart those adhesions in that muscle and that band, that fibrous band, all of a sudden one treatment and that knee pain goes away. So that's just an example. We do graston everywhere, upper traps, low back, neck, a lot of tendonitis, so elbow tendonitis or knee tendonitis or shoulder bursitis, a lot of different conditions we use the graston therapy for.
What is the benefit of the laser therapy?
So here at Prime Sports Med, we try to stay on top of what the current, like the best type of treatments and the new and things coming out. So we follow a lot of the sports programs, especially like the professional sports programs, college sports programs. And we added class 4 laser a few years ago. We have a very powerful 20 watt laser. And how we got into it is I saw that these college and professional teams were using the class 4 laser. So like on Instagram, different things, I saw that like BYU added this class 4 laser, Tennessee, Arkansas, Notre Dame has the exact same laser that we have. And even professional sports teams like the Twins and the Dodgers, LSU, a lot of these high profile sports teams were using these lasers to treat their athletes. So we added it a few years ago and had immediate success. Now it doesn't help with everything, but it's really good with tendonitis, other soft tissue injuries. I have a lot of results with headaches, concussions, because essentially it's shooting a very powerful photon energy into the skin. And it's a little bit different than heat. It's shooting that photon energy and it reproduces, it helps the body reproduce ATP at a higher rate. So it just causes healing much faster for certain conditions. So a lot of times the sports chiropractors will use laser on our sports therapy patients.
So we have another question. How does massage help with headaches and what are the benefits of cupping?
Yes, so most of the headaches we see are like tension style headaches, and what that means is they're caused by stress, a lot of times by posture. They're possibly they have a desk job, or maybe they're like a dental hygienist, and so they're always sitting, their neck is always flexed, and they have a lot of stress going on in their life, maybe not enough sleep, cortisol is being produced because maybe they're a mom, maybe the individual has a high stress job. And so they come in, and a lot of times the back of the neck muscles get really, really tight, and that's what's causing the headaches. So we use deep tissue massage to kind of find where the trigger points are at. There's a lot of different muscles in the neck, and so we have highly trained massage therapists and providers that are experts in finding where the trigger points are and where the referral patterns are from those trigger points. And so if we can help release the tight muscles in the neck, a lot of times that's all you need to help headaches, is just literally release tight muscles. Sometimes there's a little bit of a misalignment in the neck. Sometimes we adjust C1, C2 after a neck massage, and people have headaches that go away completely.
And then what about cupping?
Cupping is, you've probably seen those hickeys on people's backs, but we use cupping as a myofascial release technique. It's really good. Essentially, you would put a cup and it sucks up the skin, sometimes about an inch or more off the skin, and that's also pulling the fascia from the muscle as well. So what people don't know is fascia has a bigger role in these musculoskeletal injuries than we've ever seen before, and a lot of research is coming out about fascia. So you can imagine fascia like your sock. See up here, you have your muscle, and then underneath the muscle you have a fascial layer. The fascial layer is on top of the muscle, and so when that fascia gets tight, you can see it starts to pull and aggravate the skin underneath. So what cupping does, essentially, is just lifting up that fascia, and you can see that sock's already a little bit more loose. You can see it's just lifting up. So we use cupping by lifting up that fascia, myofascial release. Our massage therapists are really good at using the cups. The sports chiropractors here use the cups for a lot of different conditions. We usually use it with massage, with graston technique, with the laser, based on what we find and the conditions that we find to kind of break up the tight muscles and adhesions going on in the body.
How do I know if I need sports therapy versus just an adjustment?
That's a good question. A lot of that is preference. If someone, I would say it probably comes down to pain. If someone's really hurting, right? If you have a really severe headache, if you're really locked up in the low back where you're like walking in kind of bent sideways and can hardly move, if your knee is excruciating pain, then we always suggest sports therapy here just because we believe in it. The chiropractic adjustment helps a lot. The manipulation helps, but the soft tissue work helps it go a lot longer. And so a lot of it's severity. If someone's in really severe pain or even moderate pain, we often suggest a sports therapy treatment.
Do you guys accept any insurance?
Yes. So now we accept most major insurances. Those that have been our patients for a long time know that we were just a cash practice at the beginning. We didn't take Medicare or a lot of plans for a while. We evolved over the last few years. Now we accept mostly everything. There's a few plans we don't accept. United's one of them, but mostly everything else we accept. I'm glad to announce that we offer Medicare as well. So the chiropractic offers Medicare, the physical therapy offers Medicare, all the Blue Cross, the Cignas, the Blue Shields, the Regences, the IPNs, all those plans we accept. And if you don't have insurance, that's okay too. We have lots of cash plans available for patients that are extremely affordable, and we can get you in no matter who you are and what you have. Good. Any more questions?
I don't see any more. The only other one was about the laser, but you already answered that question.
Okay. Well, thanks everyone to our first Facebook Live kind of video that we're doing. This is going to get a lot better. I don't do the best videos, but we have some other doctors in here I think will be much better at me at doing this, and that's great. We'll have our Dr. Jared Simonson in here. We'll have Dr. Tanner Field on here as well, and maybe some massage therapists in the future, and then show you a little bit more about our clinic and what we offer. But anyway, we're proud to be here in Nampa, Idaho, and Caldwell, Idaho, treating Canyon County. We love Canyon County, and hope to see you here soon.